So we are working really in three main areas. One is our capacity building work. So in the capacity building work, we're really focusing on targeting specific education programs that address identified needs. So we've just done a learning needs assessment of our members, and education came up as number one. There's just such a need to continue to advance our understanding of treatment, of treatments and what are the implications for our patients. There's such a need for nurses to understand how we can contribute to prevention of cancer. So we will continue to sort of offer programs around in topics such as tobacco control, for example, and how nurses take such a lead role in tobacco control. So education is key. Secondly, we are looking at some projects that are focusing around knowledge development and practice guidelines. So we're doing a particular project at the moment that's looking at understanding self-management and how the nurses can actually assist patients with self-management of responses to cancer. So that'll be a really important evidence document that we will produce. Thirdly, it's our policy work, so our policy and advocacy. So we have a range of position statements. We, through the last couple of years, we've sort of done some, in 2020, we launched a major statement that was published across a number of key journals, which really looked at articulating the role of the oncology nurse, of the cancer nurse, across the continuum of cancer care. And what contribution nurses are making across that continuum. And we published that in 2020 because that was identified as the International Year of the Nurse and Midwife. And so that was a really key document that we published in partnership with some of our partner organisations. But we are continuing to add to our suite of position statements. So we published last year one on COVID, on nurses, cancer nurses' role in responding to patients' needs through the COVID pandemic. And we have new position statements that we're working on at the moment around leadership in cancer care. So that advocacy role will continue to be so very important. And lastly, I think it's our partnerships that we have. I think that we know working across the world is quite challenging, and the only way we can actually make a difference is actually working with our colleagues and partners. So that includes our member organisations, it includes our partners in the International Council of Nurses, it includes our partners at UICC, for example.